Hi, everyone. My name is Manju Abraham. I'm a VP of Engineering at Hewlett Packard Enterprise. I'm a founding member of Shakti, a platform for professional women to inspire, empower, and educate each other through shared learning and mentoring. Today, we shift a bit from our usual topics around leadership, organizational excellence, and personal growth to focus on the crisis at hand. We wanted to gain some insights into what we can do from here in the US to help our families and friends if they are exposed or become COVID positive. Let me introduce you to my two esteemed panelists today. Mishi Choudhary is a technology lawyer and online civil liberties activist working in the United States and India. She's based in New York and is a founder of India-based SFLC.in, a digital rights organization. She's the one who wrote the article that I posted below about the loss of her father-in-law in the fight against COVID. Manju Nayar is a dear friend, a doctor who's working as a clinical research project manager in the Department of Internal Medicine, University of Minnesota, on COVID-19 clinical studies. She too lost a father-in-law to COVID, and the experiences from both of these wonderful women align with the stories I've heard from several others who went through very similar heartbreaking scenarios. My heartfelt condolences to both of you and your families. What caught my attention in the article from Mishi, as well as in my conversations with Manju, was the way they looked forward to apply their lessons learned during such a dark time, but now to be of help to others who may go through similar challenges. Thank you, ladies, for joining us. Now, Mishi, would you share a bit of a summary of your experience recently?
Thank you, Manju. Thank you for doing this. As I said that, unfortunately, we are all united in grief, but hopefully we can also find strength in our losses and do something better, because things haven't really changed much. People are still dying and heart-wrenching pictures are coming all the time. I'm sure people's phones are still buzzing with similar pleas, which are now moving from those cities like Delhi, Bombay, to now tier 2 cities as well as the rural areas. What I went through is, I think about my father-in-law, who was a very sweet and a fun-loving person, easygoing, and he loved whenever I visited India. I have a nonprofit digital rights organization in India, which took me to India more than my husband. And he really looked forward to my visits so that we could eat street food together, which I really missed being here. And then we could fight over politics. And my mother-in-law would always wonder that, and she would shush us and say, "You are so loud, both of you, that the neighbors are always wondering when she comes why there's so many fights in the house." But we were yelling and screaming all the time of disagreements on politics. He truly loved me like a daughter. And I think one of the things which I will always remember is my mother-in-law told me that when he was in the middle of being conscious and subconscious and was being taken to the hospital, he called out for his daughter's name and he called out for my name. He didn't call out for my husband's name, but he kept calling out for the two girls. And both of them, my husband has a sister, one sibling. He lives here, we live here in New York, and she lives in Bombay. They live in Delhi. Both of them had had one dose of the AstraZeneca, which is known as the Covishield vaccine in India. And they'd been very careful all along throughout the year. And we had been quite paranoid about their health. My parents also live outside Delhi. My parents had gotten the 2 doses and they were about to get. I think it was, I'm sure that either it was the bank or the grocery store or the household help. We can't say how they got it, but they tested positive. My mother-in-law tested positive, and then within 5 days, my father-in-law also tested positive. It was supposed to be mild, but uh, increasingly his condition kept deteriorating, and then the struggle from April 29 to the day he passed, which was May 4th, started, which unfortunately, despite our best efforts, as I lay out in that article, resulted in his being not here with us today. But I don't think that COVID-19 killed him. I do think it was a perfect storm of callous authorities, inaction by the government, complete overwhelmed health infrastructure, and profiteers. All of that contributed to something which happened. He didn't have to die, and I would say malpractice as well. We faced everything that could go wrong. He didn't have to die. All of us have to die one day, but this is not his time, because if things had
Could have been
worked out,
prevented, right?
it would be different. But yet here we are now trying to figure out how all that is happening still, and where it has traveled to parts of the country. How can we help? We are all sitting here in the United States, where it seems very surreal, because many people are vaccinated. Things seem to be opening up. There's so much of discussion about economy and other positive things. People are planning weddings and barbecues for Memorial Day. And to my mind, these are two different worlds I inhabit. I think with our families and friends there, we never leave the country or of our birth.
Yeah.
So we have this dual existence where at one point we see, in one existence of our nights or days, we see things really looking up, and vaccination so easily available. On the other side, people waiting to even get basic medical supplies.
Yeah. It's like a split screen movie, right?
Mm-hmm.
So two different experiences altogether. Yeah. So sorry to hear what you went through. What about you, Manju? You're on mute.
Sorry, Manju. I muted myself, realizing that I was not muted and I didn't want any disturbance while Mishi was giving her, recounting
That's
her
fine.
experience.
Yeah, that's fine.
But
Go ahead.
Mishi, when Manju shared your article with me, and I replied to her after reading that, and I was talking to my husband too, that it almost felt as if you had just transcribed my own words, my own experiences. It's just that you lived those experiences and you wrote it. I didn't just write about it. That's exactly how I felt, but in two different cities. My in-laws are in Bangalore and yours were in Delhi. That's just about the only difference that I could feel from that heart-wrenching article that you wrote about your experience. And mine is also pretty much similar. Just to briefly give an overview of what we went through. My in-laws are in Bangalore, and in my situation, my husband is an only child, so there's no siblings anywhere, and we are so far away here in Minnesota, and they are in Bangalore. So the guilt is many times more. The responsibility that you feel is many times more, and the helplessness that you feel is so much, because you're just sitting here so far away. In a normal situation itself, it's difficult to reach out and help, and it's in a pandemic situation which has gone so bad. It's just. I mean, I just don't need to. I don't need to tell you how difficult it was. So the similar situation, and in I was just thinking, in my father-in-law's case, they both were vaccinated, one single dose for both of them, yes. But during the initial phase, when the pandemic started out in India, and we all saw that India was in a pretty good shape, right? Comparatively. I mean, of course, there were a lot of lives were lost, but then, and each life lost is a big, huge thing, especially for their families. Yes, for us, it's numbers. But at that time they were pretty careful about, the way their lifestyle and all that, and we kept telling them to be extra careful. But I think a kind of what do you call it, kind of comfort level crept in, where letting your guard
Complacency.
down, complacency set in, where okay, we have lived with this for this long, nothing is going to happen, kind of thing. And my father-in-law, every time we called, he would be the one to caution us. My husband, he knows that I would be very careful about everything and extra cautious, but caution my husband and my two boys that you have to be very careful, you shouldn't be going out anywhere. And on the other hand, he would still be going out at least to get his groceries. And it's just that lifestyle that they follow, it's so difficult to change them at this age, where they don't have that concept of ordering things online and getting it delivered home. They have to still step out to the grocery store, even if it's just the neighborhood one, and go get things themselves. So in spite of cautioning us, he would do the exact opposite of going out every other day to get his, if it's milk or vegetables or whatever. And we don't know where he got it from. And April 21st was when he first had his symptoms, and I was thinking, okay, they both have the vaccine, so it most likely started as nausea, vomiting, and gastrointestinal symptoms, and a little bit of sore throat. And I was like trying to think, okay, it's not going to be COVID, because they have both the doses of vaccine and they've been so careful. And so I told my husband, I don't think there's anything to worry. I think it's a regular flu, but of course we had him tested, and then come Friday, the results came back as COVID positive. So we were all in a shock. And the fact of the matter is, they're all by themselves there, just the two of them. We are so far away. They don't have much of family or relatives there, or even too many friends there, because they moved from Hyderabad to Bangalore, resettle, because we were in Bangalore for a long period of time. So they came along with us to settle in Bangalore, but then we moved out here and they were left in Bangalore. So they're still establishing their roots over there. But fortunately for us, Rajiv, my husband's first cousin, is right there in Bangalore. And she was godsend. She was in Dubai for the longest time, but in June, she moved to Bangalore. It was almost as if God's, or whatever life force sent her there, just to be there for them, because she ran the show 24/7. She was the ground force for us 24/7, replacing us, as what we should be doing.
It is good to it is good to have somebody like that to help. What are the steps that you kind of followed from here to kind of help her? And as soon as you heard that he is COVID positive, what did you do to try to help him with the recovery? Because this is to help others who are listening to us to see what can they do from an attempt to help them standpoint from here. What are the things that you...
So, as soon as we heard that he's COVID positive, one of the first things that we said is, what can we do to help? Is there some kind of a nursing facility or something that we can help set up for them? So in Bangalore, there's an organization called Portia, PORTEA, I think. And they do have, fortunately, facilities where they do send COVID care nurses. So again, this cousin of mine mobilized that, and she sent me the information, and she called and she got this nurse, home care nurse, who happened to be a Malayali, from that same, state. And he was COVID positive twice, and then he was vaccinated. So I think they have a group of individuals like that in their organization who they sent out.
Very good information, Portia. Okay.
Yeah, Portia was the organization's COVID care patient. So we got that kind of a help. And of course, we tried to mobilize, reach out to every possible physicians that we know over there. She reached out to multiple people in her, social circle. I reached out to my friends in Bangalore, and my in-laws, of course. My mother-in-law also turned positive in 2 days. So they're both sick people there. So reaching out to people, forming WhatsApp groups, because WhatsApp is one of the main means of communication right now. And what in Bangalore, and I'm pretty sure it is there in other cities too, there is what is called these COVID warriors, so to speak. The group of people who have come together in a community to help out people like this. And of course, a remote help, yes, but they're all sitting there and monitoring the different facilities to give out information and to help in whichever way possible. So she connected us to that. We formed a group, multiple groups, to help my father-in-law with, because his symptoms were a little bit worse than my mother-in-law's. So reaching out to people, trying to find some kind of help from somewhere. That's the only thing that I could do, sitting from, so far
What
away.
kind of help were you looking for from them at
So
that time? Mishi,
initially,
if you also have any thoughts to add to this, please do.
yeah, initially for us, it was having somebody, if possible, to have somebody at home, which we didn't realize was possible, but luckily that happened. So this person was there to monitor their, oxygen level and their symptoms and all that throughout for one. Getting help to food delivered home, because of course both of them are positive, not able to cook much. That was a challenge too, because their taste buds, with COVID is all over the place. So getting the kind of food that they like was difficult. And then on top of that, they're not the kind of people who eat out a lot. So getting them to adjust to that kind of outside food. Again, this was, arranged through the cousin. 3 times a day it was delivered home. She arranged the payment and all that. So getting the food delivered, getting this care, getting, nurse, getting some, first of all, yes, getting the COVID test done, for which, they do have the same organization have people who come home and do the testing. And then this, I think we get the results online, right? And at that point in time in Bangalore, and I'm pretty sure right now
Is
it's
it similar in Delhi also, Mishi? Is there something?
So there are certain different groups which have come together. I know that there are 2 foundations, at least Hemkund Foundation has been doing some fantastic work, and so has Khalsa 8 been doing. But there are smaller groups based on which part of the National Capital Region you are in. We worked with there was a foundation which had come up, which was called Little India Foundation, and they were working to provide certain help. My father had 2 years ago a minor stroke, and he had an entire doctor's team at the Apollo Hospital. So one advantage we had was that we knew a lot of doctors there. So and they also had service, but we had a very odd experience. We got a home nurse, not through a service, and the person came and he was monitoring my father-in-law's sugar levels as the diabetologist had prescribed. But in the morning, he just ran away and switched off his phone. So it's 6 in the morning, and we're trying to figure out. And the doctor says, if you have a nurse at home, and why this had happened, and this is related to a question you'd asked earlier, Manju, about things to be careful about. So, like Manju said, that even my father-in-law's first diagnosis was April 21st. They reached out to a doctor who had been treating my husband's uncle already from Max, a reputed doctor, a reputed hospital, so they relied. And even before this conversation, I was going through everything which had happened. There is this prescription which on the left-hand corner says comorbidities nil, which I only later realized it when I was talking to the diabetologist. My husband and I were reviewing was the fact my father-in-law had hypertension and diabetes both. The doctor never bothered to ask on an online telemedicine consultation that whether he has diabetes or not. And because my mother-in-law had tested positive 5 or 6 days before my father-in-law, he gave them both the same exact medication.
Wow.
So my father-in-law was put on steroids, Medrol, from the very first day, which everybody, including my doctors here in the US and some other people who we consulted later, told us about how it had suppressed his immune system. And it is always only after between 5th to the 7th day is when they prescribed steroids, or if the oxygen levels were really going down. His oxygen levels at home were totally fine. So I would say that the first thing if you're doing is please ensure that you have a simple WhatsApp message for your patient with the name, their age, the date of the diagnosis, if they have any kind of comorbidity written in capital letters, and also whatever you have observed, what their sugar levels are, their blood pressure levels are, because doctors are not paying attention. So have that message ready so that you can get it circulated. Second thing is always consult more than 2 doctors. Just verify whatever is the prescription, because it happened not in one case, it happened in our network multiple times, but this one is obviously personal, so I know it. Make sure that you tell them what the comorbidities are. The third is that there's been enough literature now, a lot has been talked about abuse of steroids in India, and using them at the wrong time. I mean, Manju is a professional here and she knows more about this than I know. I only know about from experience and what I've seen. But that abuse is still going on to some extent. And I would really caution against that. And any drug which is prescribed, please do verify with another doctor. This is not to say that they're intentionally doing it. There are issues about it. A, they're overwhelmed. They're all being stretched too thin because the medical system is totally stretched. B, government guidelines were not updated since July of 2020, and they were only updated now in very recently in April. And then also the doses which are being prescribed for certain steroids are way above what is being prescribed perhaps here. If you look at the CDC guidelines or the National Health Guidelines, they're really different. If it is a 32 mg, we are looking at in India about 35 to 140 mg. So those are real important things to oxymeter at home. But people are not, people need to put the oximeter for a longer period of time and take the lowest reading and inform that to the doctors instead of, so it's a range which they have to record, not just one reading. So it's the range, because another doctor later kept asking us that, why have you not recorded a range? Because if it went down even once, that means that's the range you are recording.
Yeah. Manju can probably help us understand. So I've heard that even if you have nail polish, or there are even simple things like that can give very wrong readings from the oximeter. So you have to be very careful. So that's where the standard deviation has to be looked at carefully. Yeah, that's useful information. Manju, you had tried to get him into a hospital and all of that also after the day, the care from the person from the Poshia Foundation was given, right? So how did that go? Tell us a little about that as well. Both of you, I think both of you managed to get them to the hospital also, right?
Yeah. So
How did that go? So what are the steps? If you had to find, I've heard that getting hospital beds itself is so hard. So how did you go about that? And even, getting into the ICU, getting an ICU bed, for example, or even medicine access like remdesivir, right? So I've heard horror stories about that. So how did you both manage that part?
yeah, it was a horror story for us too, to get him into the hospital. So like I said, he was tested positive on, positive result came back on April 23rd. The initial period for the first week, he kind of showed signs of recovery. He was initially in a bad shape, but he showed signs of recovery. His the pulse oximeter reflected his oxygen levels to be kind of, stable around 95, 96 to 94. So he started taking things easy. He started walking around, and I tried telling him multiple times that this is not the time to do that, because right now, basically there's something called a happy hypoxia or a silent hypoxia that a lot of people go through that I thought I could talk about later with other questions. But where you feel symptomatically okay, although inside your body your lungs are still going through that inflammatory process, but symptomatically a patient feels okay enough to be walking around and doing the activities of daily living, which is very deceptive and which is very dangerous, because people then exert themselves more and do things that they should not be doing while they're COVID positive, which is what happened with my father-in-law too. So he started walking around and the nurse would not listen to the nurse, and then suddenly a week later his oxygen levels just plummeted to 70. So that was an emergency. We needed to rush him to the hospital. And like I said, we have been, constantly communicating with my cousin, and she, and also this WhatsApp groups that we formed with a group of people like these COVID warriors through my husband's company through other contacts on the ground in Bangalore. And, many people connected us to a lot of other local people that I don't even know about. And everybody started trying to get a bed for him. So my cousin arranged an ambulance and rushed him to the nearest hospital, which is Manipal Hospital. I I shouldn't be naming it, but just a kilometer away. And the hospitals, the system, like Mishi said, was collapsed. I mean, the hospitals were just overwhelmed with patients. But a hospital like Manipal Hospital, which is such a big tertiary hospital with adequate facilities that you would think, didn't have the bed to admit him. So they just gave him a little bit of oxygen in the ambulance and then turned him back, saying that they cannot admit him. So he was brought back home 1 kilometer, and the ambulance driver charged 15,000 rupees for that 1 kilometer of drive where a patient had no intervention happening and then brought back home. So these are all the other sides of it. The positive side was, these COVID warriors getting together, and they were the ones who were trying to help unknown people like us, right? Find a bed or find an ICU, find the medicines, find some care of help. That's the positive side of it, where the citizens are coming together to help, where the government is failing, where we should be turning to the government for help. Infrastructure is failing, like Mishi said. The support system is failing, but we have these kind of people supporting on one side, which is the nice side. The other bad side being these kind of,
the profiteering kind of situation,
profiteering at the wrong time. Yes. So he was brought back, and through the day he actually remained at home. So I told that he has to be on that prone position, which is pretty much the only thing that's going to help right now while we're searching for a bed. And by evening, so what happened is, among these COVID warriors, there was a person who supposedly knew us while we were staying in Bangalore, but we didn't know him. So he had a lot of connections, political connections and all that. And somehow or other, initially we were given the information that there was a bed available 2 times. But each time, if you have to have that bed, you have to put in a deposit, a money to hold that bed for you. So basically you're reserving your bed for a COVID patient, putting down some down payment. But those hospitals were like about an hour away from our house. So by the time the cousin arranged the thing, we got the information that the bed is gone. So the third time, luckily for us, a hospital which was pretty close by walking distance from our house, they suddenly had a bed all through this COVID warrior group. This person that we didn't even know, he managed to get this bed, informed my cousin, and she immediately sent this nurse out. He went running to the hospital just because it was close by, put in that deposit, held the bed for my father-in-law, arranged the ambulance and transported him there. So he was admitted there. But his condition that day was pretty critical. Being 70, it has to come up through these measures and intervention. And the doctor, I was talking to the doctor who admitted him, and he said, his condition his prognosis is not looking good. He needs an ICU. So I asked him, is there any way possible that you can arrange an ICU for him in your hospital? Because where am I going to look for an ICU for him right now outside of this? He said, you don't know the ground situation here. We have only 7 ICU beds and all of them are full. So I asked him, is there any possibility that at night somebody can be moved out? Maybe is there anybody who's recovering that you think could be moved out? He said, absolutely no. And on top of that, I have 7 people waiting in the ER and 5 people waiting outside the hospital just for a bed, and we don't have anything to offer them. So this is a smaller hospital, not a bigger one. Yes. So, hospitals are getting overwhelmed because basically they don't have the infrastructure to support this kind of a pandemic. Yes.
Yeah. So this is useful information for folks here because, there are things to expect that we have to be prepared for. We have to get the contacts through WhatsApp groups, the different warriors, COVID warriors, as well as getting to all of your any connections that you may have. Looks like connections are needed if you are to, help our family at all, right? So,
get on social media. Unfortunately, I used to have a big following on Twitter, and I lost my account, which is what I was missing to mobilize people for others. But I will say that a ton of WhatsApp groups, which we were already part of, whether it were people who were alumni groups from school or just professional networks, friends networks, or if you put out on social media, a lot of people are doing, there is a Twitter handle which is run now by Indian Youth Congress, which is now doing quite a lot of work. Tweeting directly to some of these foundations really does help in terms of arrangement of hospitals. In at least Delhi and areas around that, A lot of gurdwaras have now done that and come up with oxygen bed in hospitals. In fact, some of them I have been personally involved with, where the big food halls have been now converted into oxygen bed hospitals.
Yeah.
So I will say reaching out to everybody. It doesn't matter which platform you are on. All those platforms are made of people. So that does help. We fortunately had a very strong network. It was Delhi, it was people who we knew. But even with our resources and our network, my sister-in-law's sister-in-law is an IS officer, very highly placed. She's the one who got us this one bed in a God-forsaken hospital before we moved him to Medanta. And I think um, they really were not giving him at that time the medicines which were he was supposed to be given. And we had our own nurse, and we had another doctor from Bombay who actually smuggled an injection through that nurse and administered it to him because the doctors were just not paying any attention. And that's why by the time we got, it's the same thing as Manju saying, by the time you get news about one bed and you just say, okay, we'll get the patient there, but they're in various parts of the city. And if the city is under a lockdown, by the time you get there, it's gone. And it's not easy to get ambulances. An oxygen-based ambulance, good luck getting one. We got one for moving him from the hospital to Medanta, again, 5 minutes drive for 28,000 rupees. And Medanta always sends its own ambulances. But there was just, I will say that my sister-in-law was herself on the ground. My mother-in-law was home because she herself had COVID. And my sister-in-law had help. She had a driver, she had some friends who had come in. My siblings are there and they were helping, but on phone because they were also COVID positive and recovering at home. So the problem was that a lot of people just who would generally show up just can't show up. And even if you have the financial resources or you can find beds, or sorry, if you know people, if you well, how in India it works, you know somebody, you call someone. But if there is just no bed, nobody's going to kick out one patient or the other.
Yeah.
And so at one point in time, as I say, in the piece I wrote, I actually thought that my husband, myself, my two siblings, we were, and his sister on the ground and his brother-in-law, it felt we were running a control room with 200 people in different directions. And the conditions were so bad that the hospital, at least by the time we got there or at home, you had to arrange for an oxygen concentrator on yourself, by yourself. You had to get the oxygen cylinders. Some of the foundations told us, like Hemkund Foundation was that time saying that you bring the patient and we can give them oxygen, because there were actually literally people in their cars with oxygen cylinders and masks plugged in, fitted on their mouths. So the problem was that the doctors were just making everybody run everywhere. The hospitals were so short on oxygen that it was always from once you find one cylinder, you find another one. And then the profiteering problem is a separate problem, but not, but being sold something fake. We got sold 2 cylinders, which were empty, for 84,000 bucks. They were empty oxygen cylinders. And somehow we found out my brother had to do a bunch of stuff, but that kind of stuff is also happening. Then remdesivir, which was 6 vials, were required. And 4 of those were fake.
Wow.
We got 4 vials actually shipped from Bangalore through somebody, and 2 we got from some other person. And so you're not only struggling with trying to gather all of this, but now you have to become your own doctor. You have to procure everything, and you also have to verify what you're procuring, whether it is actually reliable or not. So, and as Manju was earlier saying, the food part is also an issue, because earlier your relatives or friends could get together. But now everybody's watching out for their own health and they're fearful. So getting deliveries of food for and a lot of it is for our parents or our elders who are of a certain lifestyle. It's not a 22-year-old who will just do a Swiggy or whatever is the delivery service
Yes,
in India. So
that's true.
that is definitely a challenge, but I will say social media does help. Reach out to friends, relatives. If we didn't have our friends, more than even I would say more than anybody, our friends, our extended family, our professional networks, everybody helped. Everybody really, really helped. And to Manju's point, the citizens have come together to really stand up for each other, while the politicians are doing, even after all of that, not ready to put their heads together to solve actual policy problems.
Hmm.
And that's why it is frustrating, because once things didn't have to get this bad for the entire world to pay attention. In the beginning, even before this happened with us, I was still a part of a group, volunteer group, who was trying to help. We were trying to pay for ventilators, and one of our people was one of the person in the group. He was trying to exactly solve the problem of when the ventilators land in India, then the customs were not releasing
Customs.
them.
Yeah, we went through a similar
Can get them to the
experience through our.
hospitals.
Mhm. Yep.
And there are just so many institutional problems, and
Yeah,
which is a major challenge. And this I'm talking about people who are not wanting for financial or other resources.
right. It must
If
be so
somebody
much
told me a
harder.
lakh, I didn't care. But there are people for whom that time it's a matter of their life also, not just
Right.
the person who is sick.
Yeah, yeah. I have another question to ask. This must be very tough for you, but it's part of the reality as it is now. You have to help arrange the funerals and last rites per the religious traditions in India, right? From here. So how did you handle that? Manju and Mishi, if you want to give any suggestions or inputs on how people can take care of that.
I don't know if I have suggestions, Manju. I can just share the experience that we had sitting so far away, like I said, right? Where in Bangalore, in each city, I think it is different. In our home state, Trivandrum or Kerala, it's different. But in Bangalore, where they were, there is an organization or the corporation called BBMP, Bangalore Brihat Mahanagar Palike. So they are the ones who kind of take over control of. Once a COVID positive person passes away, and then it's completely under their control and following the COVID protocol. So they just take away the body in an enclosed, like we have been seeing pictures and videos on news in New York, like
Mm.
where she's staying in Italy and other places. So just bundle up the body and cover it up, and they just take it away. So in our case, the person was going to take it away in the morning, and I right away in the morning, and I talked to the doctor and told him that you have to hold off because we have not informed our mother-in-law yet at night that he passed away at night. So we didn't want to do that and give her a shock at night. So he said, okay, I can wait till 10 o'clock in the morning, ma'am. That's the maximum I can wait. And while in the morning, then he called us on video, myself and my husband, and he showed us a quick video of our father-in-law who's just covered up in a blue, whatever plastic thing, I don't even want to say thing, and just one glimpse. We don't even see the face. And after that, we said, okay, we don't want to see anymore because it's heart-wrenching. I mean, this is not how we want
You want to
anybody to go.
remember. Yeah.
This is not how we want to remember that person. See, like Mishi said earlier, everybody has to die someday. And, people, my father-in-law was 81 years old. He has lived his life. But the form of the way that he died and the way that, the funeral or whatever was conducted, the lack, we are not able to give the respect that a person who has passed rightfully deserves, right? We are just sitting here watching him being taken away by an unknown person. A single, this only son is sitting here and watching that, the tremendous amount of emotional trauma that my husband went through in that particular time. I just don't have words to describe that. We're just seeing a video for a minute and we said, we didn't want to see it any further. And we asked our mother-in-law, after we brought the news to her, we asked her, would you like to see him? And she said, no, I don't want to see him. I just want to remember him the way I saw him before. So now this, so like, like Mishi said, and like we all know, this is a COVID situation where nobody, even if they so badly want to come and help, they cannot come and do anything to help because of the fact that we are, the people are COVID positive, they're in a house together. They cannot come out and do anything to help. Every single person who wants to help can only do it remotely. So there's nobody who can really go with the dead body to the funeral site. And I had a conversation about this with his doctor, and I asked him, see, my husband is feeling so guilty because he booked the ticket to come, and then his uncle stopped him from taking the ticket and flying out right away. So he said, so this is the situation. In BBMB takes over, they have a slot for cremation, and there is no way that with the amount of people, bodies that is taken for cremation, that you will be able to keep your time slot. So if your slot is at 1 o'clock, your cremation can happen maybe at 5 or 6 o'clock. So do you really want your husband to sit with the PPE in a closed ambulance waiting for 6 hours for the cremation to happen? So the advice is that you kind of set aside your emotions during this time and start to think logically and practically. This is right. So there's no emotional things anymore. You have
feeling of guilt that I've heard from so many. What you're suggesting is that doesn't help in any way. It doesn't help you. It doesn't help them. And we have to be just realistic and pragmatic about the situation.
It is very difficult to do, because considering if it is your parent or your child or your sibling or your partner, it's very difficult to cut off that emotion and think practically. For an outside person, it is easy enough to say, but it is that the lived experience, it is something that I think my husband will carry to the grave. I don't think he will ever get rid of that horrible feeling ever, right? But that is the only way to go, though, if you want to function, if you want to move forward, setting aside emotion, think pragmatically, like you said.
But one thing that Mishi wrote in her article, that her husband was immediately thinking about how to help others. How can the oxygen cylinders be used and put to good? So the work that they had done, how can that be of use to others? That kind of sometimes helps bring some closure, the next step, right? So do you want to add something there?
So I will say that the hospital Medanta, they were excellent help in cremation process. As Manju said, yes, the state gets involved, but they were able to help where my mother-in-law and my sister-in-law could go to the cremation ground. And my sister-in-law, and they just could see the face as the body is covered in PPE. And so my father-in-law's face one could see. I didn't have the heart to say. They took a picture and I just couldn't do it. And I had to tell them that don't show it to me, I'm not gonna come. And then she insisted on cremating him herself. And so she did that, and that was possible. And then my husband is not religious, but his family is. So they also, I will say that I don't have the details now, but maybe I can get them. But nowadays, all the rituals can be conducted via Zoom. And that's what my mother-in-law and my sister-in-law, two of them did at the home after the cremation, which my husband watched on WhatsApp. And as you, those practical questions kick in very quickly, because even at the hospital, you need to give information, the usual bureaucracy of issuing a death certificate, taking certain things out. How are you going to do that? So, but they went, they did the cremation, and everything else. The priest helped to conduct via Zoom. So everything was online. One could just watch in, which is what my husband did to sit with his mother. What I will say, yes, I think he just had to put and channelize his grief into something. because like Manju was saying, it's so overwhelming. And I will say, as much as I loved uncle, um, and as much as we were close, but I don't think that I can feel it, what my husband is feeling. That's his father. And I know as um, how I think about when I think about my parents, and that chill runs through my spine. That's exactly what's happening to my husband at that time, and his sister, who's there. But I have to say, my mother-in-law has shown tremendous courage also, and she said, "No, I'm gonna do it. I'm not gonna let somebody else do it," and she did it. Did the cremation, went through all of that, and what because as we had only used 2 vials of remdesivir, and we had some more coming because we thought that he would need it for further, and we had oxygen cylinders. So yeah, my husband was trying to then arrange. Within a day, everything was gone. There were 4 or 5 oxygen cylinders, concentrators, remdesivir was all gone. And then he was on to saving. So what had happened was that we had gotten in touch with 2 other doctors who we trusted more. And then what my husband started doing was taking everybody's prescription and running a consulting service through these doctors to say, this is what they're administering. Do you think that's right? If not, do they have to be moved somewhere else? And then we would move to our network to say, okay, at X place we need this, and at Y place we need that. I think
Connecting the dots, kind of, right?
he was so much. He did that for like almost a week before he crashed.
Yeah. It's
Because
in helping others, we find, resilience, I would say.
yes, and I will say this, that that's why there's a follow-up which I did to the article, because a lot of our friends and other people came together to exactly find, what do we do? Can we just sit here and watch helplessly? But there is just so much going on, and I have to say it to anybody who's watching, even one thing which you do, if you can put a connection together and get something done, it is helpful. But please verify. People don't have time. If you're forwarding a link to somebody, they already are inundated with 60 links by somebody. That's not helpful. If you're just going to say, I have WhatsApp contacts, that's not helpful. That makes you feel that you're doing something, but that's not helpful. What is helpful is, if you have 6 numbers, call them from here. We are sitting here, we can make phone calls. And WhatsApp works, phone calls work, everything works easily. So telecom makes it possible. Make a phone call, ask them. That's how a lot of people helped us. That my friends did not send me anything. They just said, I have spoken to X person. They are waiting for you to go and get it picked. Do you have a driver? Or I have already sent my driver. Where is it that you want to get it delivered? I think that's what we can do from here.
From here.
We can conduct these phone conversations. We can make those connections sitting from here. The other 3 things which we've done, at least, because we had to narrow it down, is a friend of ours started building a hospital. They just started first with raising money for ventilators, and these are lawyers, and I'm a lawyer, so I'm in the community, we know. So they started building a hospital. That hospital is now up and running. We have 50 beds. Now we're going to have 30 more ventilators. So there's a link on my LinkedIn profile, follow up with this. It's a hospital, and it is in the poor area of Delhi, because we know those are the people who don't have the resources, even the kinds which Manju and I have, or you have. So we're helping that hospital, so we can donate money. And the good part is that this is all being done because people know we want to help. Nobody's making money here. We give regular updates of what's happened. The other one is, and Manju may be aware of this, it's the Bangalore Kidney Foundation. The founder is a friend of mine. They've been running it for many years. And these are people like everyday laborers who get free dialysis, but are now also getting COVID treatment, but they're also getting food and nutrition. and also vitamins, which are really required because they have no place to get rehabilitation. And if you're a day laborer, you just don't have money. That's it. So the Bangalore Kidney Foundation is the other cause we are supporting. Again, personally known. So if somebody gives me even $50, I can show them what was done with their $50. And the third part is of policy, which I understand. And policy is a much larger battle, which we are fighting today in the Supreme Court of India and few high courts and with the government. These are things like why aren't the vaccines being manufactured in India? Why the one Bharat Biotech's vaccination not open to other Indian manufacturers? There are 19 other organizations which manufacture and have license to do human-based vaccines, but Indian government hasn't shared its own technology when it is telling the entire world, including the Europeans, the Americans, to say, you should be sharing, your tech transfer should happen, patent waivers should happen. So we filed a lawsuit there. We filed a lawsuit in the Supreme Court of India because the platform to get vaccination is only in English. It's a tech app which works on OTP. So a variety of people who don't have a smartphone or who don't have internet connections, which is what happens in India, or now 2 weeks have gone by and the app was supposed to be available in 14 Indian languages. It has not been made available. So there are all these people, they're not vaccinated. There's no hesitancy. They want the vaccine, they can't get the slots. And there are no vaccines. Government of India has said, you have to complete 84 days before we can give you the second dose in certain cases, or sometimes it's fine. Now, we've seen the studies of this variant, and Manju is more qualified to comment on that, but the UK study says with one dose, you only get protection up to 33%. 30%. With the second dose, it goes up to 88%. My father-in-law had one dose. He's not here. And so when government does such things, we can't only rely on citizens' help, because citizens can't manufacture vaccines. Citizens cannot solve problems of there is an app which is a problem. Like Manju, you yourself a technologist, you know, all the technical people, they have telegram alerts. The urban youth went to the villages and took away their slots because they know how to game that system. There were fights between the villagers and the urban youth. So what the third thing is my own organization, and I'm because I have an infrastructure in India, we've pivoted to do things which help COVID policy, to challenge the government on that, to say make things simple and easy. Let people vaccinate by walking in. That's it. Why are you selling vaccination from 18 to 44? Vaccination price is from 900 rupees to 1560 rupees from that age group. Why are we doing that? And we have to change that. So it's policy, but it's also other things which we can do. So to keep our sanity, we are only concentrating on these three main efforts while connecting people the way I said, whether it's a WhatsApp group, or if you know somebody, or if you can provide a food service, or if you are on social media and you see a cry for help, don't ignore it. It's not just your usual cry for donation. It's an actual person who's just not able to find any help.
Yeah, thank you. And as an engineering leader with a global team limits, I can see how many of my engineers in India and their families were also struggling. So that is the connection that I could see also. And there corporations like HPE were stepping up. And I'm really proud to see what they have done. I could hear about Rajiv's Infosys also stepping up to help out. They were having a similar vaccination drive. So HPE, for example, to help the employees and their families, they were helping with COVID testing, hospitalization, telemedicine, even vaccination drive right now is actively going on. So those are crisis management team. And of course, all these colleagues, people came out of the woodworks to help, right? I can hear that in your stories as well. And but the community cannot. So that's where corporations as well as the government have to step up. And there is also helping fellow colleagues as far as the rest of the community is concerned too. Now, the employee assistance programs have been quite useful. So I've been recommending that to my teams here from a grief counseling standpoint.
Yeah.
And that sense of guilt, all of that folks feel after the loss, right? It's tremendous. And then in India as well, after going through something like this, and even if you recover, the PTSD situations are real. So it is important to explore and make use of all these facilities to keep yourselves and your families healthy and safe, both physically and mentally. Now, while this is indeed a heartbreaking story of loss, we also have to look at the courage that was shown. So the strength and courage, it's really reflected in the actions of the grieving son and his mother, and now you as well. And I know that Manju continues to help others and give them advice along those lines from her experience. So it's reflected in the way you focused on providing that help and continuing to take action. Is it against the government? Is it about helping through your nonprofits? And you're continuing to help in times of need and saving other lives. So thank you for doing that. So thank you, ladies, for your kindness and generosity during such a time to come and share such useful insights. We really appreciate it. Your experience, hopefully, when people listen to it, they can get an understanding of this is what you can expect, and these are steps that you can take to kind of counter it as much as possible. So during these stressful times, let's stand up for and support each other, and let's reach out to our families, friends, and colleagues and ask, are you doing okay? Let's lead with compassion for others and for ourselves. Thank you.
Thank you, Manju.
Thank you, Manju.